John Cahill is the Global Chief Executive of McCann Health, a strategic consultancy that unites health experts across 6 continents. So he's the ideal person to talk about the Workforce Development Goal number 8, working with others. Dr. Cahill, what does collaborative working and interprofessional education mean to you?
Well, I think what we've learned at the conference, and certainly it plays out in the work that we do within our organization, is that the recognition of competencies within a certain group has to be pushed forward, but in a way that actually doesn't create barriers towards those competencies collaborating very effectively together. And what we're now finding in the healthcare delivery system is that there are an immense number of competences. They're somewhat siloed. They would work much better together. But if we can also pull that back into the education system and remove silos from there where collaboration could then supercharge the education system, we would end up with a better healthcare delivery system for the future as well.
And what, according to you, are the drivers or potential indicators for this goal?
I think probably we were looking at some metrics in the recent part of the meeting. I think some of those metrics would be the way in which we strengthen the system. It would be looking at ways in which knowledge is moved around the system more effectively and efficiently. We would see improved clinical outcomes, of course, in the healthcare delivery systems in which this has been put in place. And I think we would also see massive gains in efficiencies, not just cost efficiencies, but efficiencies in the way in which healthcare gets delivered to the individual. And one of the areas that I would also like to see is that we would see a much higher level of participation for people in their own health and health within the community.
What is the role of student associations in making these goals a reality?
Well, I think there's 2 points to that. One is, of course, institutions will be bringing this goal in so that we can create more effective workforces for the future. The second point would be that students and their student associations should really look at the issues within attitude. You know, a system of goals will only go so far, but the people participating in those have to take them through to their full fruition. And attitudes can be as much of a silo as can anything else. So we'd ask students to be open to the collaborative learnings, to look at integrated systems where they will be sharing tasks and health outcomes with some of their colleagues in the medical area and sometimes in technical areas. And then at the same time, perhaps a point that I'm very keen on, and that is that diversity drives innovation. So within diversity, we should look at gender, we should look at creed, we should look at culture, and accept all of these various issues that the goals will affect and take a plethora of learnings into what we would do as individuals. So, you know, be open, embrace the goals, embrace collaboration.
Thank you. This is Whitley Yee reporting from FIP.